So we've been here today on protest as part of our ongoing campaign to try and stop NHS Gloucestershire, local NHS bosses from outsourcing our local community health services, which is the 9 local hospitals, 9 local health clinics, including Stroud General Hospital and Beecher and county-wide services like health visitors, from being outsourced. First they wanted to put them into a so-called social enterprise, which is a private limited company outside the NHS. And we had a judicial review of that and a settlement out of court with NHS Gloucestershire that they wouldn't pursue that option, that they would consider NHS options, and that they would engage with the public and staff over the decision they were going to take. And it's a couple of months on from that now, and we don't really have any indication that the NHS bosses are going to pursue NHS options. And we've recently heard from both then and Neil Carmichael, our local MP, that they have to put the services out to competitive tender, which we think will inevitably lead to a private provider. But the reality is that they don't actually have to put these services out to tender. In most of the rest of the country, community health services have just been passed to an NHS trust, and that's what we think should happen here. Most recently in Yorkshire, services were passed to an NHS trust, and Virgin, a private provider, tried to challenge this in court and say there should have been a tender, and their case was thrown out. So we think we need to keep the pressure up on our local politicians, whether they're MPs or councillors, keep the pressure up on the local PCT by writing them letters. We'll find out how to do that on our website, and keep fighting to keep our Gloucestershire's NHS public and the country's NHS public.